Hi, I'm Dr. Mangesh Kamath. I'm a senior consultant medical oncologist, hemato-oncologist, and bone marrow transplant physician. Today, we are going to discuss a huge heterogeneous set of diseases which are commonly called as head and neck cancers. Head and neck cancer constitutes cancers of the various subsites of the head and neck, and in general, they are bracketed into the same disease called as head and neck cancers because the principles of management of head and neck cancer, the behavior of these head and neck cancers are similar in a majority of cases. So, head and neck cancer is probably the top 3 cancers that we see in India. And it is a cancer which not only affects in majority those individuals who abuse tobacco and alcohol, but also in a small minority those individuals who may be infected with a virus known as a human papilloma virus. Now, it is difficult for us to discuss all the causes, but in general, I would like to mention that the large majority of cases of head and neck cancers that we see in our country is because of tobacco chewing, tobacco smoking, the snuff, and so on and so forth. So it is unfortunate because, as you would know, that any of the preventable cancers are probably something which we should not be happy about because they were preventable in the first case, and they mostly may not have happened if the abuse wasn't there. So, as we all know, there are advertisements coming in TV regarding head and neck cancers, and there are so many tobacco cessation programs that are available, but it is in general very common to see individuals, especially those belonging to the lower class, the working class society, abusing tobacco extensively. So you would have seen a lot of construction workers, you would see a lot of unskilled laborers, you would see a lot of the ladies who are sweeping the roads, who are always constantly chewing tobacco or keeping the tobacco snuff, and it is very unfortunate because they are not aware of what the long-term effects of their habits are. So, head and neck cancers, basically, as I told you, can be divided into multiple subsites. I will not go into all of them in detail, but I will let you know which are the subsites. So, one is the lips, as you can see, and the buccal mucosa, or we call them as the oral cancers. You can also get cancers of the tongue. You will get cancers of the oropharynx, or the opening of your mouth that leads to your food pipe, that is, which we call as the oropharynx, which leads to basically not only the food pipe but also the air pipe. So oropharyngeal cancers are very common in our country. Then you also get cancers of the voice box, or the cancer of the larynx. The cancer of the larynx is very common. Again, it is very commonly seen in smokers and also those who are exposed to industrial air pollution. And then you also get some of the lesser common subtypes, such as cancer of the air box in our face, called as the cancer of the sinuses. You also can get the cancer of the external ear, and so on and so forth. So in general, if you really look at it, we divide the head and neck cancers into the subsite of the head and neck cancers, and that not only tells us about the possible cause of the cancer, it can also tell us about what is the aggressiveness of the cancer, and last but not the least, it also helps us determine what could be the best treatment protocol for the cancer. Let me give you an example. If you have a cancer of the buccal mucosa, we consider that operation should be, or a surgery should be, the first way of treating the cancer of the buccal mucosa, because by and large many a times you can remove the tumor with a good margin. But when it comes to cancer of the oropharynx, that's really behind, it's difficult for us to give surgery in those individuals, because if you do surgery, they will not only lose their voice but also their swallowing function. So In oropharyngeal cancer, we don't prefer surgery to be the definitive therapy. We prefer it to be radiation. So we give radiation therapy, that is multiple X-ray beams that are given to the neck, and that is focused onto the tumor so that the tumor can be destroyed. What is the role of a medical oncologist? What is the role of chemotherapy or targeted therapy or immunotherapy that is available for head and neck cancers? The medical oncologist in many institutes is considered to be the director for all the head and neck cancers. Basically, our role is to make sure that there is a multidisciplinary discussion that occurs for head and neck cancers. We perform what is called as the tumor boards, during which we discuss all the modalities, such as whether a patient requires surgery or not, whether a patient requires radiation, whether a patient requires radiation after a good surgery is done, what is the role of chemotherapy, and so on and so forth. So chemotherapy in a nutshell is required when we are giving radiation for those patients with oropharyngeal cancer, because it increases the amount of the tumor kill that is achieved by radiation. So there are multiple theories of it, but in general, if the concurrent chemo radiotherapy is given for oropharyngeal or laryngeal cancers, you are bound to get a higher response for the tumor, and a higher tumor kill is achieved. And it is also known through various studies that higher cure rates are also achieved. So that is the role of chemotherapy, and it is something that is not negligible in practice. It is definitely required in a large majority of cases. Now, what exactly you do when the head and neck cancer is very advanced, it is extensive? There are a lot of individuals who come to us in our practice who did notice that they had a small tumor. They were afraid to meet a doctor, or they thought maybe it's such a small ulcer, so it may go away on its own, or they applied turmeric and so on and so forth. Those patients continue to have their cancer growing, and then they come to us in an advanced stage where the cancer has gone and infiltrated into the critical structures of the head and neck, such as the muscles and the nerves and arteries. So in these cases, it is seldom possible to operate or give just radiation to those patients initially. So in those cases, we employ what is called as neoadjuvant chemotherapy. The concept of neoadjuvant chemotherapy is to downsize the tumor so that then we can either do a surgery or then we can do a focused radiation. So it is very important that neoadjuvant chemotherapy is given for advanced tumors which may not be currently undergoing surgery because of the limitations that are there due to its large spread in the local area. So mostly after a neoadjuvant therapy, when we see a very good response, then we treat them like I told you, we do surgery, and after surgery, if there are certain high risk features, in those cases we can give what is called as adjuvant chemoradiotherapy. So this is head and neck cancer for the early and the locally advanced stages. Sometimes the head and neck cancers may be very extensive, such that there are ulcers. So there could be the tumor seen through the outside of the mouth. I have seen many patients coming with the ulcer. You can almost see a hole in their face, and sometimes they have very bad trismus or a lockjaw, due to which the muscles have been involved by the tumor and they just cannot open their mouth. So they just have liquids. Sometimes they go to a dentist and even break the front of their teeth so that they can take something orally which is a little sizable. So it is very, very frustrating for us to see certain cases like that, because it is very difficult to cure such situations. In those cases, we employ usually chemotherapy, and if a patient is affordable, we employ immunotherapy and targeted therapy, so that we can reduce the tumor burden and also improve the patient symptomatically. Now, is there any benefit of giving that? Yes. When we give chemotherapy with or without immunotherapy and targeted therapy, we have seen patients living beyond 2 or 3 years, and they can also have a better quality of life as opposed to not taking any therapy at all. Does the tumor from the head and neck spread to other organs? Yes, it is possible. It is possible that the tumor from the head and neck can spread to the lungs, and in these cases, we call it as a metastatic stage head and neck cancer. And again, in those cases, we have to employ chemotherapy with or without targeted therapy and immunotherapy, so that we can, one, control the disease, 2, prolong the life of the individual. 3, improve the quality of life of the individual. So without that, there is a lot of suffering that we see in head and neck. Not only is there a cosmetic issue, because once you have a tumor in the head and neck, it is very commonly seen that you can have lots of swellings that are visible. Sometimes the swelling may be because of the tumor, or sometimes the swelling may be because of the lymph nodes that are enlarged when they are destroyed by the increasing tumor cells. I hope you got the head and neck cancers in a nutshell. There are many more details that I would like to provide you. If you have any questions, please post them, and if required, we'll make many such videos in the future. Thank you.